Well, as you know by now, many industries have shortages. That is the same situation in healthcare. Bethesda Health Group has some solutions to help patients and nurses. We have Eileen Caffey joining us this morning to talk a little bit more about this with Bethesda Health Group. Good morning to you.
Good morning.
So first off, what are you seeing in terms of this shortage?
Well, I think everybody knows that right now we are struggling with just not having enough healthcare workers in the St. Louis metro area. This was true before COVID, but it's actually been exacerbated since the pandemic. And so what we're really trying to do is find innovative ways to make sure that we can staff all of our facilities and have all the people that we need to care for our senior citizens.
I understand there are two approaches. Let's talk about the first one, the Contingency Nurse Program. What does that involve?
Sure. The Contingency Nurse Program, I like to think of it as adding bench strength to our team. So we are hiring nurses and we're giving them the opportunity to have a flexible schedule that they can choose, to give them the ability to earn more pay. But in exchange, they're going to be flexible with us and they're going to be able to go to whatever facility we need them to go to whenever we need them.
That makes a lot of sense. How are you helping international nurses actually find opportunities here in the States?
We have started hiring international nurses. So we've got some nurses we've made offers to that are coming in from the Philippines that are still in process. We've also hired some nurses that were actually educated in the United States, but were foreign national citizens. So we are helping them through an organization that's helping us sponsor them to stay in the United States and continue to work here.
Yeah, are you seeing a pretty good response both internationally and to the contingency program, Eileen?
To the contingency program, definitely. It gives us kind of an innovative employment offering in the marketplace. And the international nurses side, we've definitely found some great candidates. The challenge is the long, really lead time of them getting to this country. So we're still waiting on a lot of them to get here, but we're excited about the people we've been able to find, and they're excited about being able to move to St. Louis.
Are you still short-staffed?
You know, we are not in terms of we are always, recruiting. We hired just as many nurses last year as we did the year before. We also supplement with agency nurses when needed. So we're really holding it together, but it's a challenge. And when your team is ill and several people call in sick, that's really where the contingent nurse program comes into play, because we will now have that bench strength where we can plug people in as needed when needed.
Yeah. How do you see the industry changing in the near future?
Well, I think in terms of the healthcare industry as a whole, it's a great opportunity, and I hope that some of the young people who might be watching the show today consider going into careers in healthcare. There's tremendous opportunities for folks. You don't have to be a doctor and go to school forever. There's a lot of opportunities for people to start as a certified nurse assistant and work their way up to an LPN and an RN. And we actually have a career ladder program that we offer that gives people that training at our facilities.
Yeah, interesting, Eileen. My mom went to school along with me to get her LPN and then her RN. So we were doing schoolwork at the same time. But yeah, it's definitely a great profession. And she worked even teaching on up to into her 70s. So definitely a great profession.
Wow, that's amazing. Yeah. It is. And I admire nurses so greatly. And I'm so happy. We've got a great team and we're just trying to add to it.
All right. Thank you so much, Eileen Caffey. We appreciate you joining us this morning.
Thank you very much.
And if you want more information, we'll also provide you with links at fox2now.com.